Well, Jimmy, so many people, including myself, have been there. They eat a meal and then all of a sudden they feel a painful burning in their chest, sometimes up in the throat. It's a classic case of heartburn.
Done the same thing. According to the International Foundation for Functional Gastrointestinal Disorders, about a third of us adults have experienced that painful feeling just within the last year. So let's take a look at what's happening to the body when somebody has heartburn. The National Institutes of Health says heartburn occurs when stomach acid backs up into your esophagus. That's the tube that carries the food from your mouth down to your stomach. Now, obviously, some people get heartburn more often than others, and according to the National Institutes of Health, if you have heartburn more than twice a week, you may have a reflux disease that's known as GERD, which is a condition that often causes heartburn. Now, as far as how you develop heartburn, well, just a few moments ago, we mentioned food. That's a biggie, and it has a lot to do with it.
Yeah, in fact, certain foods in particular are known for triggering heartburn. According to the National Institutes of Health, they include alcohol, caffeine, carbonated drinks, chocolate, and citrus fruits and juices. There's also peppermint and spearmint, spicy or fatty foods, full-fat dairy products, and tomatoes and tomato sauces. Now, the institutes report pregnancy and many medications can trigger heartburn or even make it worse. Now, regardless of what causes your heartburn, one thing's for sure, people who have it want to get rid of it. That's why they turn to medicine.
Oh my goodness, and turn to it in droves. Did you know that according to gastroenterology professor Dr. David Metz, in 2012, heartburn medication was the second most prescribed class of drugs behind statins. But could that medicine many people are taking to solve one problem be causing another? Well, this afternoon, a warning about some popular over-the-counter heartburn medication and its possible link to the health of your bones.
Grace Tejchman is well aware her bones are getting older.
About 2.5 years ago, I started developing some issues in my back and my leg. It would hurt so bad after I was done exercising.
She also has a stomach condition called reflux. To control her symptoms, she's been on medicines called proton pump inhibitors for 9 years.
And if I don't take it, the acid backs up and then I have severe heartburn and the ball in my throat. I actually went into what I thought was like a heart attack. It felt that bad.
If she stays on the drugs, she worries what might happen to her bones years from now.
You don't absorb calcium, vitamin D, magnesium.
These medicines called proton pump inhibitors, or PPIs, are very good at controlling symptoms of heartburn and healing esophageal erosions from the abnormal flow of stomach acid back up into the swallowing tube. PPIs include popular products like Prilosec, Nexium, Prevacid, among others, and these days they're over the counter. This class of drugs has been around since the late 1980s, and just now doctors are seeing the first groups of patients who have taken these drugs long term.
We've seen things like osteoporosis, vitamin and mineral malabsorption, such as magnesium, calcium, interactions with other drugs.
People who take the medicine twice a day or for more than a year have a higher risk of broken bones. Fractures have been seen at the tip of the thigh bone and wrist most frequently. While the pattern suggests PPIs play a role and PPIs can affect body chemistry in a way that can lead to bone loss, a study to show causation has not yet been done. Nevertheless, concern about length of treatment is reasonable.
Once you have gastroesophageal reflux disease, it is a progressive disease. If you've been on them for 5 years and you really don't have an endpoint and your lifespan's another 30 years, you have to ask yourself, what's the end point?
Alternatives include medicines to coat the stomach, medicines called H2 blockers, or surgery. Which of these to choose is the decision that Grace now faces.
If I can fix a problem and not take the pills, I think it would be better off.
Okay, now again, as we just mentioned, the findings linking bone problems to those medications are still early. Experts say you shouldn't take acid blockers for more than 2 weeks unless you're being supervised by a doctor.
Now, in addition to medicine, there are also lifestyle changes that may help you avoid the discomfort that can come with heartburn. We already mentioned some of the foods that can trigger heartburn. While we're talking food, according to the National Institutes of Health, avoid bending over or exercising just after eating. Also, avoid eating within 3 to 4 hours of bedtime and eat smaller meals while you're in bed. The NIH suggests sleeping with your head raised about 6 inches to prevent digested food from backing up into the esophagus, but you don't want to just use extra pillows because you can slip off of them. Instead, the NIH says try placing bricks or books under the leg or the head of your bed, or use a wedge-shaped pillow under your mattress.
Now, did you know there are also some changes that you can make that involve your body? The NIH says if you're overweight, try getting rid of a few pounds. In some cases, experts say reflux symptoms can go away after an overweight person loses 10 to 15 pounds. Avoid tight-fitting belts or clothes. They can squeeze your stomach and force food into reflux. Also, the NIH says stop smoking. And finally, try to reduce your stress. Things like yoga, Tai Chi, meditation might just help you relax enough to provide relief from heartburn.
I didn't even know what heartburn felt like until I was pregnant with my first child.
And lo and behold.
Lots of heartburn then. Well, we've been talking about making changes. One thing that hasn't changed over the years, a Sussex County theater that has stood the test of time. The old and the new come together to bring Dagsboro an historic cinematic experience. We'll take you to the Clayton Theater, find out what makes this Delmarva treasure so special.
Well, something that's special to a lot of kids are these guys, hermit crabs. The little sea creatures with the colorful shells that are sold up and down the Eastern Shore. We're going to introduce you to a shop that says they were one of the first in the United States to sell them.
And we're hoping Sean Stryker sells us with his clues in today's search for Stryker. He's somewhere on Delmarva and we're trying to figure out where. Sean, we need our first clue.
All right, guys, here comes your first clue. This town was made a royal port by William and Mary in 1694. What do you think? Any guesses? If not, coming up, I still have 2 more clues. Delmarva Life, we'll be right back.